Google, Facebook, and your internet service provider know a lot about you. Every time you click on anything on your computer or smartphone, it's one more piece of data about you. Put all that data together and it makes a fairly complete dossier about you. Multiply that by hundreds of millions of people, and you have a goldmine of information about society as a whole. But while big data and analytics are changing the world, one industry that's lagged behind is healthcare. It's true that most doctors put all your information into an electronic health record whenever you visit, but most of that record just sits where it was collected.
This is a big challenge in the industry, and the commonly used term that refers to this challenge is interoperability. So when we digitized patient medical records over the last 8 years through the Affordable Care Act and the High Tech Act and so on, we forgot to ensure that all of these new systems, these electronic health record systems, would interoperate. In other words, talk to one another through a common set of data exchange standards.
That's Paddy Padmanabhan, CEO of Damo Consulting and author of the book, The Big Unlock, Harnessing Data and Growing Digital Health Businesses in a Value-Based Healthcare Era.
We are now, in hindsight, retrofitting a set of standards, but it's slow going. And it's also now complicated by the fact that the data sources have vastly multiplied. So your physician that you go to, your primary care physician, his or her practice doesn't necessarily talk to the hospital down the road where you might be referred to for a procedure.
That means that the clinic has to start over on your health history. What's more, none of your previous illnesses and treatments are likely to be put anonymously into a national database to help doctors figure out what treatments work in the real world. But Padmanabhan says a variety of factors are pushing healthcare to get into big data in a big way. One is the transition toward evidence-based care.
What that simply means is that there is some amount of accountability that healthcare as a whole needs to take on. Accountability for improved healthcare outcomes, accountability for reducing costs, and accountability for improving the overall experience for patients and also for caregivers. So in that context, we are really talking about data being front and center, and the data is going to enable healthcare as a whole to understand where to focus resources and how to use data and the insights arising from data to improve outcomes.
And while healthcare providers have more accountability today for the end result of a health transaction, consumers do too.
You and I, we didn't have a lot of choice earlier, and we didn't really care because our employers paid for insurance, so we could go in and consume as much healthcare as we needed to. And health systems didn't really need to tell us what it costs to do anything, whether it's a hip replacement or whether it's just a routine annual physical. They were billing the insurance company, and the insurance company was paying them. So there was a misalignment of incentives all around. But now, consumers are now taking more and more responsibility, financial responsibility for healthcare costs. And that, in turn, is driving them to look carefully at the choices that they're making.
Once data sources are linked up, the amount of medical intelligence could be exhaustive. So exhaustive that Padmanabhan says artificial intelligence will likely be used to sort it all out, though it won't replace your doctor.
The amount of medical literature and research that's getting published is humongous, and it's humanly impossible for any one oncologist, no matter how skilled they are, no matter how on top of their profession they are, to stay on top of all of the emerging literature. So to help with improved diagnosis, to help kind of narrow down your diagnostics and treatment options, you can use emerging technologies such as AI to help crawl through tons and tons of literature, medical literature, combine that with structured data such as your electronic health records and with your genomic data and everything else, and make intelligent conclusions about the possible range of treatment options and present those to you.
But where would all this information come from? Most people could imagine using insurance claims and electronic health records, but other sources could be troubling if you'd prefer they be kept private.
For example, Internet of Things, smart devices. These are now ubiquitous, whether it's your Apple Watch, your Fitbit, or a glucose monitoring device that you wear as an implant or on your wrist. And all of these devices are now smart and are throwing off data. The data can be used along with the health records and your medical records that sit with your physician or your hospital to make improved judgments about your medical condition, whether to intervene with you if, for instance, your glucose levels are progressively shifting in the direction of a possible diabetic situation, just to use one example, and a variety of such use cases.
And if you've had your genome sequenced, which can be done for less than $1,000, Padmanabhan says that's a treasure trove of information too.
That, in combination with your own personal medical history, can inform your doctor in ways that just your medical history alone wouldn't be able to.
Sometimes information like that could be life-saving, or it could be used against you. For example, if an insurer gets hold of it.
I was talking to the CIO of a nationally known health system. This is exactly the challenge, the conundrum that they're grappling with right now. They did a small pilot where they looked at genomic data and looked at medical histories of a small population of individuals. And they could tell with almost near certainty there was a percentage of the population that they could identify that were at very high risk of Alzheimer's, but they were not yet diagnosed with Alzheimer's.
Padmanabhan says cases like that illustrate why security fears have also helped to slow down the use of analytics in healthcare. Strict ethical guidelines could help police access, as could the use of blockchain technology, like that used to secure Bitcoin transactions.
It's a very different way of maintaining records, transaction records, among other things. And so think of it this way: if you were managing financial transactions with your bank and you had an immutable record of the transactions that everybody agrees upon and cannot be changed in future, and it also gives you a clean trail of the different transactions that have taken place on a particular asset. That technology is today blockchain.
Padmanabhan says he's optimistic that all of this could happen in the next generation, if not sooner, resulting in more effective treatment at a better price. You can find out more about all our guests on our website, radiohealthjournal.net. Our producer this week is Sean Waldron. I'm Nancy Benson.